Artificial intelligence doctor. User question. To what extent does a dual-chamber leadless pacemaker system improve hemodynamics and cardiac output compared to a unicameral system, particularly in patients with atrioventricular block? Claude AI answer. This is an excellent question that touches on a key potential advantage of dual-chamber leadless pacemaker systems. To address this comprehensively, we need to consider several factors. 1. Physiological basis. Dual-chamber pacing allows for coordination between atrial and ventricular contractions, which more closely mimics natural cardiac physiology. This is particularly important in patients with atrioventricular (AV) block, where the natural conduction between atria and ventricles is impaired. 2. Atrial contribution. In a normally functioning heart, atrial contraction contributes about 15 to 30% of the total cardiac output. This atrial kick is especially important during exercise or in patients with reduced ventricular compliance. 3. AV synchrony. Dual-chamber pacing maintains AV synchrony, which can lead to improved ventricular filling, reduced mitral regurgitation, more efficient ventricular contraction. 4. Comparative studies. While extensive data exist comparing traditional dual-chamber and single-chamber pacemakers, studies specifically on leadless systems are more limited due to their relative novelty. However, we can hypothesize that the hemodynamic benefits would be similar. 5. Patient-specific factors. The extent of improvement may vary depending on the degree of AV block, underlying cardiac function, presence of other cardiac conditions, e.g., heart failure. 6. Adaptive programming. Modern dual-chamber pacemakers, including leadless systems, often have algorithms to optimize AV delay, which can further enhance hemodynamics. 7. Exercise capacity. Dual-chamber pacing may provide greater benefits during physical activity when the heart needs to respond to increased demands. To quantify the extent of improvement, researchers might look at parameters such as cardiac output measurements, e.g., using echocardiography or invasive hemodynamic monitoring, exercise tolerance tests, quality of life measures, long-term outcomes like hospitalizations for heart failure. It's important to note that while dual-chamber pacing theoretically offers these advantages, the clinical significance can vary. Some studies with traditional pacemakers have shown modest or inconsistent benefits in certain patient populations. To fully answer this question, we would need controlled clinical trials specifically comparing dual-chamber and unicameral leadless pacemaker systems in patients with AV block. These studies would ideally include both acute hemodynamic measurements and long-term clinical outcomes. Would you like me to elaborate on any specific aspect of this comparison, or discuss how researchers might design a study to address this question?